here again. So let's talk about, the nurse practitioner, pretty much the growth and challenges associated with the nurse practitioner role. So if you are preparing for the exam, maybe you are curious about the rapid growth of the nurse practitioner role. Either way, this video is going to cover high-yield exam topics related to the growth, regulatory framework and constraints of the nurse practitioner profession. So stay tuned. Nurse practitioners are more in demand than ever. But what factors are driving this demand? With the shortage of healthcare providers, the NPs are stepping up to fill the gap. So patients want accessibility, patients are demanding high quality care, and the NPs are well equipped to deliver. So consumer demand is on the forefront. Over the years, patients, providers, and legislators have become more accepting of the nurse practitioners as a primary specialty care provider. So that's another thing pushing, the NP's popularity, the acceptance of the NP's advanced practice nursing role. So mental health is finally getting the attention that it deserves. And the psychiatric mental health nurse practitioner are at the forefront of this movement, helping to reduce barriers to psychiatric care. And this is really significant. So the psychiatric mental health nurse practitioners, are moving this aspect forward. And again, there has been decrease in stigmatization. More people are seeking mental health services. And with that, the role of the psychiatric mental health nurse practitioners are expanding in integrated care settings. So the emphasis of holistic team-based care has positioned the nurse practitioner as a key player in the mental health treatment across medical, outpatient, and community settings. So overall, the nurse practitioner role is significant, and that means you will be scrutinized. That makes it even more important to pay attention to to the nurse scope of practice, what you are required to do, and how you can perform care more effectively. But it's not just all smooth and sailing. There are several challenges that the nurse practitioner, including the psychiatric mental health nurse practitioner, face in today's practice. For instance, the competition is growing. Okay, so that has posed a challenge for the nurse practitioners, including the psychiatric mental health nurse practitioner in their practice. Another thing is the reimbursement struggles. Some Medicare and private insurance companies either want to underpay or refuse the NPs, reimbursement, making it difficult for independent practices to thrive. Other healthcare providers, including the physicians and PAs, sometimes challenge the scope of the NP practice. That is why, as a nurse practitioner, you should be well informed of what you are expected to do. And again, there's been concerns over reimbursement fraud. And this has to do with incorrect coding and billing. It can lead to accusation of fraud. So these are the areas you want to pay attention to so that you don't get caught up in the negative. So let's talk about some basic things I want you to take away today. What are certain things that can lead to disciplinary actions? One, when you begin to prescribe without a collaborative agreement. This is a big deal. You must understand your scope of practice. You must study the Nurse Practice Act. So in some states, and it differs, it varies from state to state. So some states have full practice authority and some don't. So you want to understand what your state is involved in. If you're practicing without a valid license, if you're a nurse, you want to be very careful. Even if you're in nursing school and you do not have a valid license, or you are a nurse practitioner and you do not have a valid license for a particular state, this can bring upon disciplinary actions. So you want to pay attention. Regulatory violations, fraudulent billing, practicing without a license can lead to serious disciplinary action. You always want to remember, for the fact that you're certified does not mean that you are licensed. So pay attention to that. So now let's talk about what governs the NP practice. The Nurse Practice Act, okay, in each state determines what the nurse practitioner can do or what they cannot do. So the Nurse Practice Act governs the NP practice. It protects the title. So only those who meet the educational and certification requirement can be called nurse practitioners. It defines the scope of practice. Scope of practice simply means what a nurse practitioner is legally allowed to do. And like I said earlier, it varies from state to state. Remember that some states have full practice authority while others require physician oversight. Now, what are the differences between credentialing and licensure? This thing seems basic, but I want to assure you that basic is important because we overlook basic things, and basic things are the things that are going to get you into trouble. And basic things are the things you might see in your exam and you get confused because you're paying attention to the very difficult things, and you're leaving generalized things and things that are common and things that you are expected to know as a nurse practitioner. So credentialing, sometimes people tend to use it interchangeably. But you need to understand that they are two different things. Credentialing protects the public by ensuring that you meet that minimum level of competence. So it's a protection for the public, and that's why you go to school, you take that exam, and then you get credentialed. While licensing is states grants you the permission to practice. So you can be credentialed, but you are not licensed. License gives you permission to practice. So if you are credentialed and you don't have a license, you cannot practice. So if you are credentialed and you want to practice in 5 different states, you must apply for licensure to have permission to practice in those states. So certification, you can be certified by the ANCC or you can be certified by the AANP. There's no one is superior. They are both acceptable. It depends on what you want to do. So if I may ask, what entity is responsible for granting the NP licensure? And the answer to this will be your state's Board of Nursing. So after getting certified, you apply to the State Board of Nursing where you wish to practice so that you can have permission to be able to practice. So state boards regulate the NP practice. They determine the licensure requirements and they enforce the State Nurse Practice Act. Pay attention. So let's wrap up here. So the roles of the NP are growing due to consumer demand and mental health awareness and integrated care models. But we still have some challenges, which include job market competition, reimbursement issues, and scope of practice conflicts. Each state has a unique regulation with the Nurse Practice Act defining the NP scope, the credentialing process and disciplinary action. Okay, so if you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more high-yield NP content. Drop your questions in the comments and let's get you certified. See you in the next video.